Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hey everyone, Michael Reynolds here, and welcome back to Research Perch from the Massage Therapy Foundation. I am the marketing chair for the marketing committee for the Massage Therapy Foundation, and we're so happy that you're subscribed to our podcast. Thanks for joining us. Here with Nikki Monk and Ruth Warner. Ruth, how are you?
I'm terrific, Mike. How are you?
Great. I always envy you out on the beautiful Oregon coast there. And Nikki, how's your day going?
Doing well, thanks.
Excellent. So Research Perch is designed to unpack and really help with some insights into articles and studies from the International Journal of Therapeutic Massage and Bodywork, which is located at ijtmb.org. And so we certainly hope our listeners are subscribed to that journal online. It's free. So today's article, I think, is fairly significant. I'm really interested specifically because it addresses chronic low back pain, which, I mean, how many clients see their massage therapist for chronic low back pain? Probably a gazillion, right? So the specific title here is titled Better or Worse, a study of day-to-day changes over 5 months of Rosen method bodywork treatment for chronic low back pain. So it's a very long title, kind of a mouthful, but very specific and descriptive, I think. So first off, just help me out here. Ruth, could you tell us what Rosen method is?
No.
You cannot?
I mean, I have received one session of Rosen work, and that was several years ago. I can tell you how the author describes it. This author is named Dr. Alan Fogel, and he is, at least at the time of publication, was based out of the University of Utah in Salt Lake City. And he describes the Rosen work Rosen work method bodywork as being a combination of touch and sort of keywords. And the purpose of it is for enhancing embodied self-awareness. It's an interesting idea, and one of the places where I felt some tension about this study was in scope of practice issues, because we have to be quite careful about delineating between what is body work and what is, body work or massage therapy versus talk therapy. And in Rosen work, talk is part of the approach, although this author does delineate very clearly that within this there is no agenda to fix, and he puts quotation marks around that, but simply to observe, and maybe more than anything to help the client to observe, and that sense, that field of body mindfulness is a really interesting field of study right now, and so for me, that's how I'm sort of categorizing Rosen work in my head, is as a method to help people learn their bodies better.
Okay, so this might be a quick tangent, but what is the value in observing?
Well, for instance, and this actually speaks to a blog that went up today on the Foundation's website. People who struggle with certain kinds of problems, and really stress and anxiety and all of its manifestations are among these, tend to do better, tend to manage their conditions better if they become more self-aware about when they are building tension. So, if you're not aware when you're gritting your teeth, and then you become aware of it and you can take a breath and relax. If you're not aware when your gut is in knots, sort of like mine right now, and then you and then you become aware of it and you take a breath and relax. These are self-regulation methods, aren't they, for helping us manage our physical state. But for people who are a little bit tuned off or tuned out to what's happening with them physically, it makes no sense for them to ask them to do that, because they don't have the skill of listening to how their body feels.
Okay, that makes sense. Thank you. I appreciate the explanation. And I'm actually kind of interested in this concept of mindfulness because probably because I just read the book 10% Happier. It's on meditation, so I'm kind of exploring a little bit more about mindfulness and meditation, so I appreciate that. So,
well, it's certainly, and it's certainly a topic that's really important in chronic low back pain as well. I mean, there's especially when you consider non-specific chronic low back pain, that it's unspecified. We don't necessarily know what it's coming from, and oftentimes it is going around this idea that people are having this unconscious holding. And so being able to bring people's awareness up is a pretty logical approach, and has been shown in other areas to be very beneficial. So this is a particular method, the Rosen method Bodywork, we're using to approach that.
Yeah, and specifically this this particular article does address chronic low back pain, and you mentioned earlier that there are some really good things about this particular study, some challenging things you noticed, or kind of interesting points you want to make about it. So tell us what's going on here.
All right. So quickly, the intention, the premise of this work is that Dr. Allen or Dr. Fogel discussed the chronic low back pain and the issues, the general issues around that. I think the storm has gotten here now, Michael. Because I got
the hailstorm has reached you.
I think so. I got a little bit of a brownout, so hopefully we won't lose me. But the premise was that there's a lot of variability in symptomology and pain and fatigue, and that happens day to day, so within even a course of treatments. And the intention of this study in particular was to document, report, and discuss the day-to-day variability in the perception of physical sensation, emotional state. In this sample, this very specific sample of 5 individuals with chronic low back pain, they received 16 total treatments of this Rosen method Bodywork. They were provided weekly, so it was about a 5-month duration. The study used a new design. To me, it was microgenetic design, which specifies frequent observations over an extended period of time and in a small number of studies. So through the use of journals, the participants reported daily assessment of pain, fatigue, emotional state, and sense of control during this 5-month study period. And they actually had pretty good compliance to that. I don't think anybody missed more than 13% of their reportings in that. In addition, the participants completed the Roland-Morris Disability Questionnaire, which measures pain and disability and they also answered other questions related to perceived changes in their back pain and work-related changes with their chronic low back pain before they started the course of treatments, and then again after they finished this course of treatments. They had several different hypotheses, one of which was that the pre and post scores on the Roland-Morris Disability Index would improve, and that also they would have reduction in work disability and pain, which they showed in their 5 samples. And note too that when you have such small sample sizes like this, there wasn't statistically meaningful differences, and you can't measure that in something quite like this. They were also interested in showing the big fluctuations that happen in treatments, and in fact, for those of you who are watching the podcast, I'll actually show you one of the figures that they provided. And for those of you who are listening, let's see how this works.
Yeah, we can see it. I mean, it looks like a...
Yeah,
so basically, it looks like it almost looks like a heart rate monitor or something,
Richter scale.
Yeah, Richter scale. Yeah. So it goes up and down and up and down and up and down. And basically, it's all the different points. And this particular participant was 156 days. And so while there's a trend that goes down, which is positive, the daily fluctuations are up and down and up and down, which the takeaway for that could certainly be for clients who are coming to receive bodywork, whether it be Rosen method or what have you, is that there is variability that happens during a course of treatment. What you want to, rather than focusing on sort of the day-to-day changes, looking at the overall course of the work might be more meaningful. I think, and we could talk about some of the other challenges, but I think talking on that point first, what practitioners can take away from this study would be good.
Okay, great. I appreciate that, Nikki. Let me take a quick break before we get to some of those other challenges, because I do want to highlight our sponsor today, which is Anatomy in Motion. We're really happy to have Anatomy in Motion sponsoring this podcast today. If you're not familiar with Anatomy in Motion, it is the reason Ruth bought an iPad. So there's one of your strongest endorsements. It is an absolutely gorgeous app, and it's for massage therapists, it's for athletes, coaches, doctors, medical students, physical trainers, anyone that works with the human body, honestly. And it is in the iOS App Store. It's available for iPad and iPhone currently. And it is well worth the download. It basically it allows you to learn the muscle systems of the body, and it's really an educational app focused on the study of muscles. So be sure and check it out. Again, I cannot stress how beautiful this app is, how well done it is, just how well put together it is. Check them out on Facebook as well. If you search Facebook for Anatomy in Motion, you'll see a thriving community of people who love the app and who interact with the Facebook page and share information. So again, go to the iTunes store. It's for iPhone, iPad, iPod Touch. It's called Anatomy in Motion. Check it out. We'd really appreciate you taking a look at that app and showing some love to our sponsor. So we appreciate that. Thanks, Anatomy in Motion.
Yay!
Yay! So, Nikki, you were mentioning that there are some interesting things, maybe some challenges and things about this study that you wanted to point out as well. Anything else that that kind of jumps out at you?
Well, so first of all, one of the things this study does not do is test the efficacy or effectiveness of the Rosen method on chronic low back pain. In order to do that, you would have to have a control group, and larger sample sizes and a control group, something to compare it to, and they don't. They are using inter-client sort of measurements and seeing really more of a descriptive study of how these particular people responded. One of the things that I thought was really kind of interesting was how very precise they were on the folks that they were recruiting. In fact, in their recruitment materials, they very much specified that they wanted female volunteers between the ages of 25 and 55, so a really nice age range, certainly, who are motivated to overcome chronic low back pain. They may qualify to participate in a research study involving an investigation of Rosen method bodywork, and they would be compensated. And then from the people who called in, they selected the folks who would participate. So they were really wanting to target people who were very much motivated, who would definitely respond if there was a response. I think in an earlier podcast, when we were talking about Dr. Marashka's work, we were talking about expectation and belief, and how invested somebody is in a treatment and its benefits. And the more invested or the higher the belief, the better the outcomes are likely to be. And I think it's an interesting point to note that 3 of the 5 people that they followed in this study were actually former body workers.
Yeah.
So these folks are primed for a good benefit and a good effect.
Yeah, talk about an ideal sample size or sample group. That's pretty much ideal, right?
Right. And I think that particularly with this kind of work, I think that hinders the generalizability even more of the results of this study, even than such a small sample size of 5. I think
the generalizability?
Yes. So generalizability is the extent to which you can apply findings to larger populations.
Got it.
So
it's so specific and so hand-picked, basically.
Right. So, I would say that the next step would be to really establish efficacy in more of a controlled, systematic way. They do a lot of things. There's this tension between study designs, between more explanatory methodology and more pragmatic. Explanatory being efficacy testing type designs, and pragmatic being more effectiveness, so how things respond in the real world, how it's actually practiced.
I'd like to interject here for Michael to emphasize again the difference between efficacy and effectiveness. It took me months. It took me forever to figure out what the difference is between these two things.
Yeah, help me with that one.
Yeah, I'm going to save you guys months of thesaurus on this. So. So an efficacy study tries to create a situation in which you have the best possible chance of having a positive outcome or having the outcome that you're looking for. All right? And so, for instance, in drug trials, an efficacy study selects a population and makes sure they're not doing other interventions that might interfere with their drugs and whatever. And that's pretty easy to control because you can control the dosage of the drug and things like that. That's harder to do for massage therapy because there's so much variability for what's the very best thing from one person to another. But an effectiveness study is one that looks at how an intervention works in, as Nikki said, in the real world. And when we look at studies for massage, very often the efficacy studies are problematic, and the effectiveness studies show a pretty strong result. In this study, it seemed like they were really looking for the best of both worlds by choosing clients who were going to, most likely to have the very best outcome, while looking at the body work in a real world setting over once a week for 5 months. That's a pretty nice parameter to have to study.
Mm-hmm. Okay. No, I appreciate that because I would have probably spent months trying to figure out the difference. So thank you for clarifying efficacy versus effectiveness. It sounds like it's kind of, would I be correct in thinking it's kind of a spectrum of, I mean, they're obviously related, but it looks like kind of a spectrum. You can probably, like you said, have the best of both worlds sometimes, or
I would say a
perhaps
continuum, actually.
A continuum? Okay, that makes more sense.
By you talking about this too, it's a really appropriate time to bring up actually another article that wasn't published even in our field, but it's by Kevin Thorpe and colleagues, and they talk about this very thing, and they developed a
I think we lost Nikki.
I think Nikki lost power.
Oh.
All right. Well, she was about to make an amazing point, I'm sure. So, Ruth, would you be able to read her mind and figure out what she was about to tell us?
I am writing down Thorpe and colleagues because I am.
All right.
Know what this
says.
Well,
those are the perils of doing podcasts via Google Hangouts. Sometimes one of us loses power. So, for those who are listening, Nikki and I are both in Indianapolis, and I just narrowly missed a storm, and apparently it hit Nikki downtown, which is a little further away from me. So, Nikki, we lost Nikki for the moment, so she will be back. So, Ruth, you and I will just kind of wrap this up if that's all right. And I kind of wanted to, we're about out of time anyway, so this is a good time to wrap up. But I just want to really make sure I understand our conclusions here. So, what I'm getting from this particular study is that, like you said, the conditions are really set up favorably to do everything possible to really get the result we're expecting. So it's not necessarily discounting the results, but we have to understand that things are set up to be very favorable. And really what it's saying is people did report decrease in pain and positive outcomes with Rosen method being applied here.
And with those fluctuations over time.
Right. There was some fluctuations up and down, a lot of factors at play here. And this concept of mindfulness comes into play as well to tell us that, there's obviously more than one factor at play here. The types of people that are participating in this study, obviously they're body workers, and when you're more mindful of your own body and your healing process, that can also play a part in the outcomes as well. Would that be fair to say?
It's not a conclusion that the authors come to, but it's one that that I certainly find supported by this study among many others.
Okay.
There was another point I wanted to make here. I mean, there are a lot of places where I kind of scratched my head at this study, like not having a control. But that's not what they chose to do. So fine. But I've never read a study that really looked at long-term implications over 5 months. Tracking those fluctuations to see if, as we intuit, people do in fact improve over time, even with those good days and bad days in between. So, I don't, as Nikki said, I don't know that this is generalizable. This is a little bit like those weight loss commercials where they show the really skinny person and say results not typical, right? But for some people, this seems to work really, really, really well. And I would be hopeful that Dr. Fogel might follow this up with another study where we really do have a a more randomized population and a control group, so we can compare the Rosen method bodywork to either no intervention or some different kind of intervention for chronic low back pain.
Yeah, it sounds like it merits further research.
Oh yeah.
So, yeah. Well, it sounds like, again, if I'm correct, and correct me if I'm wrong, but it sounds like for massage therapists who maybe they're experienced in Rosen method or would like to explore it, it sounds like there is possibility that it can provide or can help with positive outcomes when working with chronic low back pain. Obviously not definitive, but there's some indications that they might want to explore this further. Would that be fair to say?
That's fair to say, and another takeaway from this is that time span issue that, while you had a bad day yesterday, we have some research that indicates over time, really things get better.
Yeah, look at the big picture. Absolutely.
Right.
All right. Well, Ruth, thank you so much. I wish Nikki were able to stay with us, but hopefully she'll regain power. Nikki's back.
Oh, there she's back.
Nikki, welcome back. We were just wrapping up. Ruth actually kind of picked up where you lost power and left us, so we're just wrapping up. So you can help us say thank you and sign off here. So Nikki, Ruth, thank you so much for joining us today, and for our listeners and viewers, thank you so much. We appreciate you subscribing. If you are watching, consider subscribing via your mobile device on iTunes or Stitcher. Links are below this video. If you're listening, please keep on listening and consider subscribing to our blog, and especially to the International Journal of Therapeutic Massage and Bodywork, which is at ijtmb.org, and that's the resource that we take these articles from, and we unpack them for you. So there's a lot more there. Be sure and look up this particular article. It is, by Alan Fogel, so just search for Fogel. I'm sure you'll find it there on ijtmb.org. Nikki, Ruth, thank you so much for joining us. Thank you, everybody, for listening in, and we'll see you next time.
Thanks, Michael.
Thanks, Michael.
Thank you for joining us for this episode of Research Perch. Please send feedback or questions to perch@massagetherapyfoundation.org. See you next time.